Part 2, the 10 Tales of FEM. Upon completion of this presentation, you will be able to explain how performance indicators support the Unit 2 competencies, describe types of student activities that would promote the appropriate level of mastery for competencies based on the Miller's Pyramid. Unit 2, Professionalism. What does professionalism encompass? Through the lens of a health information technologist. Professionalism in relation to the FEM curricular competencies for the associate level includes being an advocate for patients, advocating for the profession to promote awareness, the ability to tap into reflective practices to continue personal and professional growth, and upholding ethical behaviors. The 3 competencies in Unit 2. Let's get started. The Unit 2 competencies are 2.1, Patient and Professional Advocacy Efforts. It has 4 performance indicators. 2.2, Self-Reflection, has 4 performance indicators. 2.3, Ethical Behaviors, has 3 performance indicators. Competency 2.1, Patient and Professional Advocacy Efforts. Performance indicators. Miller's level shows. Keep this in mind. We measure student mastery attainment at the competency level, utilizing the College of Health Sciences AHIT FEM competency outcomes. Our performance indicators are those tasks, processes, and/or knowledge and skills we expect to see students completing that meet the competency. This is true of all of the competencies at the associate and bachelor level for CAHIM accredited programs. So think about it this way. The student is demonstrating patient and professional advocacy efforts through, if you change the first word to an action verb on each one of these, there's your performance indicator that you can measure. So we have supporting patients in navigating the healthcare system, including reimbursement and access to services. Advocating for health information services and resources that benefit patients, the organization, and the population. Educating others on the scope of practice and role of health information management professions. Mentoring others to support competence and professional. Let's look at the example for competency 2.1, patient and professional advocacy efforts. Our example here is going to demonstrate the action that a student is going to take to meet the level of shows. Student is asked to review a mock patient billing scenario containing multiple claims that resulted in denials. Student is asked to identify reasons for denials and communicate in a mock email the next steps to the patient on how to appeal the claim. Now, let's take that same competency, 2.1, patient and professional advocacy efforts, and let's bump that up to a does. Student is asked to utilize mock organizational data for a population health data utilization project they are completing. The student is to complete a population analysis to identify gaps, such as missed screenings, readmission rates, patterns, etc. Student is asked to create a professional report that presents findings to the organizational leadership that recommend 2 data-driven solutions, such as improved data collection methods, reporting processes, etc. Competency 2.2, self-reflection. This competency is measured at the Miller's level of does. So here are our performance indicators. Remember to keep in mind, the student demonstrates the ability to So we have self-reflect on experiences and personal opinions, learn from others, and identify growth areas. Recognize when services are beyond personal competence and consult or refer services to others. Consult the relationship between the health information management role and the responsibilities of other teams. Engage in continuing education and professional development. Here's an example of Competency 2.2 self-reflection being measured at the Miller's level of shows. Student is given a case scenario that involves a patient discharge workflow that intersects with nursing, coding, billing, and quality improvement teams. The student is asked to map how HIT professionals interact with each department through the data lifecycle. They are to identify dependencies, communication channels, and areas for the process improvement. Deliverable is a visual depiction such as a digital poster, infographic, slideshow, etc. with a short summary explaining it. Let's take that same competency and look at what the student could be performing at a does level. The student is to develop a professional growth portfolio that documents learning experiences, feedback received, and performance evaluation throughout their supervised experiential learning SEL experience. The student is to collect and reflect on real performance artifacts, summarize lessons learned, in addition to identifying areas of growth using the HEMA career map, provide supervisor or mentor evaluations as evidence of professional learning, with the last step to include an action plan for their next steps to continue on the path of professional growth in HIM. Competency 2.3, ethical behaviors. Looking at the performance indicators for 2.3 ethical behaviors, we can see that we're going to be at a Miller's level of no's. So think about it this: the student is able to recognize ethical issues and identify potential actions that support a positive outcome. They're able to identify and manage potential and actual conflicts of interest. They're able to evaluate and apply ethical frameworks to provide professional guidance. Here is an example of Competency 2.3 ethical behaviors at the nose level. Students are given a short HIM-related ethical case where the health information technician has been asked by a physician to alter documentation post-discharge. Students are asked to identify the ethical issues present, explain which AHIMA Code of Ethics principles are being challenged, and list potential actions the health information technician could take to support a positive ethical outcome. A written response is required that references specific AHIMA ethical principles. Thank you for watching this short presentation.